Safeguarding our future. Why childhood vaccinations are non-negotiable. Vaccines are one of the greatest public health achievements in history. They have saved millions of lives and continue to protect children from serious preventable diseases. Vaccination is a safe, effective, and essential way to ensure the health and well-being of our children. By vaccinating our children, we not only protect them, but also contribute to the health of our communities. Childhood vaccinations work by introducing a weakened or inactive form of a virus or bacteria into the body. This exposure triggers the immune system to produce antibodies specifically designed to fight off the disease. If a vaccinated child is exposed to the actual disease in the future, their immune system is primed to recognize and fight it off, preventing illness. Vaccines undergo rigorous testing and development processes to ensure their safety and effectiveness. Before a vaccine is made available to the public, it must pass multiple phases of clinical trials involving thousands of volunteers. These trials are carefully monitored for any potential side effects, and the data is thoroughly reviewed by regulatory agencies. The benefits of vaccination far outweigh any potential risks. The diseases that vaccines prevent can cause serious illness, disability, and even death. By vaccinating our children, we provide them with the best possible protection against these preventable diseases. Vaccines, our best defense against preventable diseases. Vaccines are designed to protect against a wide range of infectious diseases that were once common and deadly. Diseases like measles, mumps, rubella, polio, and diphtheria can have devastating consequences for children. Vaccines have dramatically reduced the incidence of these diseases, saving countless lives and preventing lifelong disabilities. Before the introduction of vaccines, these diseases were a leading cause of death and disability in children. Measles, for example, can cause pneumonia, encephalitis, and death. Mumps can lead to meningitis and deafness. Rubella, particularly dangerous during pregnancy, can cause severe birth defects. Vaccines have made these diseases preventable. The measles, mumps, and rubella vaccine, for instance, is highly effective in preventing all three diseases. The polio vaccine has virtually eradicated polio from most parts of the world. The diphtheria, tetanus, and pertussis vaccine protects against three potentially fatal diseases. By vaccinating our children, we create a barrier of protection that prevents the spread of these diseases. This not only safeguards our own children, but also helps to protect those who are unable to be vaccinated due to medical reasons. The power of herd immunity, protecting the vulnerable. Herd immunity, also known as community immunity, is a crucial concept in vaccination. It refers to the indirect protection from infectious diseases that occurs when a high percentage of a population is immune to a disease, making it difficult for the disease to spread. When enough people are vaccinated, it creates a protective shield around those who are not vaccinated. Herd immunity is particularly important for individuals who are unable to receive vaccines due to medical reasons. This includes infants who are too young to be vaccinated, people with weakened immune systems, and those who have certain allergies. When a high percentage of the population is vaccinated, it reduces the likelihood that these vulnerable individuals will come into contact with the disease. The threshold for herd immunity varies depending on the disease and how contagious it is. For highly contagious diseases like measles, a vaccination rate of around 95% is needed to achieve herd immunity. When vaccination rates drop below this threshold, outbreaks can occur. Maintaining high vaccination rates is essential to protect the most vulnerable members of our society. By ensuring that our children are vaccinated, we contribute to the collective immunity of our communities and help to safeguard those who cannot be vaccinated. Dispelling vaccination myths, separating fact from fiction. Despite the overwhelming evidence supporting the safety and effectiveness of vaccines, there are still some common myths and misconceptions surrounding vaccination. It's important to address these myths with accurate information and debunk the misinformation that can spread fear and hesitancy. One common myth is that vaccines cause autism. This myth originated from a fraudulent research paper published in 1998 that has since been retracted. Numerous large-scale studies have debunked this claim, finding no link between vaccines and autism. Another myth is that vaccines contain harmful ingredients. While vaccines do contain small amounts of preservatives and other ingredients, these are present in safe and carefully regulated amounts. The benefits of vaccination far outweigh any potential risks from these ingredients. Some people believe that natural immunity is better than vaccine-acquired immunity. While it's true that contracting a disease can provide some immunity, it's important to remember that these diseases can be dangerous and even deadly. Vaccines provide safe and effective immunity without the risk of contracting the disease. It's crucial to rely on credible sources of information about vaccines, such as healthcare providers, public health agencies, and reputable medical organizations. Section 5. The economic case for vaccination saving lives and resources. Vaccination not only saves lives, but also makes good economic sense. The cost of vaccinating children is far less than the cost of treating vaccine-preventable diseases. When children get sick, it can lead to missed work for parents, hospitalizations, and long-term medical care, all of which place a significant burden on healthcare systems and families. Vaccines are a cost-effective public health intervention. They help to prevent expensive hospitalizations, reduce the need for medical visits and treatments, and minimize lost productivity due to illness. The economic benefits of vaccination extend beyond healthcare costs, as healthy children are more likely to attend school, participate in the workforce, and contribute to society. Studies have shown that vaccination programs have a high return on investment. For every dollar spent on vaccination, there are significant savings in healthcare costs and increased productivity. The World Health Organization estimates that vaccination prevents 2 to 3 million deaths worldwide each year and saves billions of dollars in healthcare costs. Investing in vaccination is an investment in the health and economic well-being of our children and our communities. By preventing disease, vaccines reduce the financial burden on families and healthcare systems, freeing up resources for other essential services. Section 6. Vaccine safety, a rigorous and transparent process. Vaccine safety is of paramount importance. Vaccines undergo a rigorous and multifaceted safety testing process before they are made available to the public. This process involves multiple phases of clinical trials, ongoing monitoring for adverse events, and independent review by regulatory agencies. The clinical trial process for vaccines is designed to assess their safety and effectiveness. Trials involve thousands of volunteers and are conducted in phases. Phase 1. Trials evaluate the safety of a vaccine in a small group of people. Phase 2 trials test the vaccine in a larger group of people to assess its effectiveness and identify any common side effects. Phase 3 trials involve thousands of participants and are designed to confirm the vaccine's effectiveness, monitor side effects, and compare it to existing treatments or a placebo. Once a vaccine is approved for use, it undergoes ongoing monitoring for any rare or long-term side effects. The Vaccine Adverse Event Reporting System, or VAERS, is a national vaccine safety surveillance program that collects and analyzes reports of adverse events following vaccination. This system helps to identify any potential safety concerns that may arise. Regulatory agencies, such as the Food and Drug Administration in the United States, play a crucial role in ensuring vaccine safety. These agencies review the data from clinical trials and ongoing monitoring systems to ensure that vaccines meet the highest standards of safety and effectiveness. Section 8. A global imperative expanding access to vaccines for all. Vaccination is a global health priority. While significant progress has been made in expanding access to vaccines worldwide, there are still millions of children who lack access to these life-saving interventions. Expanding access to vaccines, particularly in low-income countries, is essential to protecting children from preventable diseases and achieving global health equity. Organizations like the World Health Organization, WHO, Gavi, the Vaccine Alliance, and UNICEF play a critical role in increasing access to vaccines in developing countries. These organizations work to procure and distribute vaccines, strengthen healthcare systems, and support vaccination programs in low-income countries. Despite the challenges, significant progress has been made in recent decades. Global vaccination rates have increased, and the number of deaths from vaccine-preventable diseases has declined dramatically. However, there is still much work to be done to ensure that all children have access to the life-saving power of vaccines. Continued investment in vaccine research, development, and delivery is essential to achieving global health equity. By working together, we can create a world where all children, regardless of where they live, have the opportunity to live long and healthy lives. Section 10. Continuing the fight. The importance of ongoing immunization efforts. While vaccines have made remarkable progress in reducing the burden of infectious diseases, our work is far from over. Ongoing immunization efforts are crucial to maintaining high vaccination rates, protecting against emerging diseases, and ensuring that future generations benefit from the legacy of vaccines. Maintaining high vaccination rates is essential to prevent the resurgence of vaccine-preventable diseases. As we've seen with outbreaks of measles and other diseases, even small declines in vaccination rates can have significant consequences. Complacency is not an option when it comes to vaccination. Research and development efforts continue to focus on developing new and improved vaccines for existing and emerging diseases. Scientists are working to develop vaccines for diseases like HIV/AIDS, malaria, and tuberculosis, which continue to pose significant health threats globally. Education and outreach are essential to promoting vaccine confidence and addressing hesitancy. By providing accurate information, addressing concerns, and dispelling myths, we can empower individuals to make informed decisions about vaccination.